Okay, so today we're going to be talking about epilepsy. This PowerPoint here, I have some information I'm going to go over about epilepsy with exercise, just general what epilepsy is, about the seizures that you can have, and also give a couple recommendations for the fit VP of epilepsy. We also have a video. So what is epilepsy? Epilepsy is a neurological disorder that causes unprovoked seizures from brief excessive discharges of electrical stimulus to the brain. It affects people of all ages, but it's typically seen in older adults and younger individuals. So right now I'm going to switch to a video I have just kind of that goes over some of the facts about epilepsy. So that video gives us a real good look at some of the conditions, some of the things that epilepsy has to do with. There are two types of seizures when it comes to epilepsy. There's general seizures, which can range from obscene seizures to about 2 to 15 seconds, atonic seizures are less than 15 seconds, tonic seizures less than 20 seconds, myoclonic seizures, which are ultra short jerks, and tonic-clonic seizures, which are 1 to 2 minutes in duration. There are also, which are all type 1 seizures, which are general. Type 2 seizures are partial seizures, which they're simple partial, where the person is alert and able to respond and remembers what happened during their episode or their seizure. Then there's also complex partial seizures, which the individual is impaired, has impaired consciousness and impaired recall of the events that took place during their seizure. There are no general contraindications when it comes to exercising with an individual who has epilepsy. The primary goal when programming and prescribing the epilepsy for an epileptic individual is that you control the seizures, so making them have seizures less often, which can be an effect of exercise. Submaximal tests for cardiovascular endurance, muscular strength and endurance, flexibility, and body composition are recommended when getting baseline numbers for a person with epilepsy. So the physical activity categories for a person with epilepsy is there's 3 categories. 1, sports with no restrictions. 2, sports with restrictions, like with safety precautions such as wearing a helmet, life jacket, some type of safety feature to the sport. Sports that are prohibited or are recommended to be prohibited are rock climbing, hang gliding, parachuting, unsupervised swimming, diving, motorsports. All these are prohibited just because in case something happens, the person has an episode during any of these activities that they do not harm themselves or somebody else around them. Exercise programming. Baseline test numbers can come from the cardiovascular endurance, doing the cycloergometer test, muscular strength from a 1RM bench press or 1RM leg press, muscular endurance from doing the push-up test or the curl-up test, flexibility, sit and reach test, testing the reach, the low back flexibility and hamstring flexibility of the individual, body composition, using the 7-site skin fold caliper test, and then using the, while programming, looking into programming, you'll use the Fit VP formula. Okay, and our Fit VP, which is frequency, intensity, time, type, volume, pattern, and progression. And here on the chart, comes from the ACSM guideline book for cardiovascular, which is around 5 days a week, moderate exercise, 30-60 minutes, muscular strength training 2 to 3 days a week, using 60 to 70% of the 1RM for moderate intensity, flexibility 2 to 3 days a week, where you stretch to a point of feeling tightness or slight discomfort, holding the stretch 10 to 30 seconds, neuromotor 2 to 3 days a week. Effective neuromotor intensity is not well known, but anywhere from 20 to 30 minutes per day. These are just some of the general things. You can look more in depth at it. The goals of the program for cardiovascular endurance is improve the VO2 max within 4 to 6 months of starting the program. Muscular strength and endurance is improving the general fitness of the individual and preventing muscle atrophy, which is so the person isn't losing any of their muscular strength, their size, any of their endurance. Flexibility and balance, become more flexible and improve balance are the main goals of the program. And daily life, improving everyday life, making activities easier for these individuals, lessening the possibility of them having an epileptic episode. Special considerations for exercise with an individual with epilepsy include avoiding any triggers that might cause them to have an episode, such as extreme fatigue, lack of sleep, dehydration, hyperthermia, hypoglycemia. Any of these, if an individual has any of these going on, they should be cautious about exercising, maybe stopping exercise at that time so they don't risk themselves of having an episode. Remember that making sure the exercise area is safe for the individual. There isn't anything really laying around that they do have an episode, they may fall and hit their head on. Remembering that the use of medicine for an individual with epilepsy can cause them not to have as good a performance as an individual without using medicine. And these are the references. That was my presentation on epilepsy. I hope it was helpful.